Hello, and welcome to our podcast. I'm Danny, and today, Great.com talks with Lucy Bologna, the spokesperson of the Cancer Association of South Africa, or CANSA. If you haven't heard of it, its mission is to enable research, educate the public, and advocate for and support all the people affected by cancer. Remember, if you're new here to this podcast, press subscribe on YouTube or on your podcast app. Hi, Lucy, and welcome.
Thank you. Hi, I'm so excited all the way from South Africa, and thank you for having me on the podcast.
It's truly my pleasure. I'm super excited too. And again, thank you so much for joining us. To start this conversation, I would like really to know what inspired the creation of CANSA and how has the organization evolved over the years in addressing the challenges posed by this disease?
Well, we're an organization that's actually over 90 years old. I think we're 92 years old this year. And it started by a bunch of medical doctors who saw the need for addressing the issue of cancer, the disease. So it started then, and then it has just evolved. And as we go along through the decades, the culture changes, the economy changes. And I think as an organization, you have to adapt, you have to evolve so that you become and you stay relevant. You meet the needs of the community, of the country. And then we just carried on. And every year we like to think we get better. And there are so many challenges, particularly in South Africa. We're in the Southern Hemisphere. We're part of Africa, a continent itself that's facing many economic, climate challenges. Here, particularly health. We have about 60 million people in South Africa, of which 20% really can afford private care. And then the bulk of 80% of people don't have access to private care. So as you can imagine, cancer, the disease, affects globally so many people. In South Africa, I think, for men, it's 1 in 6. For women, 1 in 8. Actually, sorry, women, it's 1 in 8 women. 1 in 8 women are likely to be diagnosed with cancer, and for men, 1 in 6. So as you can see, we have this huge responsibility to address it and to make sure that we are relevant and that we are providing services, that we are there. If somebody hears the words, "You have cancer," and to say to them, "You're not alone. We're here to help you through the process." So there's so much that we do. As you mentioned, it's research, education, and support. Those are the 3 pillars. And particularly, the education part is very much about also educating about cancer, the disease. It's not just about, okay, you've been diagnosed and we'll provide the care and support. It's also about how do we lower that cancer risk? How do we educate the people living here? And we even have people from abroad that actually liaise with us and get in touch with us, because we produce what we call fact sheets about all types of cancer. And we often talk about myths versus facts, and we produce those. So those get actually downloaded, and a lot of people request those fact sheets. So it's good to know that the information we produce is actually helping somebody.
Lucy, thank you so much for sharing all of this context with us. I think it helps us understand so much better the situation. And the numbers are quite high, right? Which is a sad statistic. It's really, really impressive. And I think the fact that you work with these 3 pillars probably makes a very huge difference in people's lives, because having this diagnostic of cancer, it's a life-wrecking. It's not just life-changing, it's life-wrecking, I believe. So,
absolutely. You can imagine being told, as an individual, you might be told, okay, you have cancer. Then it's, oh, do I have medical care? Do I have insurance? And then you've got your family. You might have loved ones, friends. How does it affect you if you're at work? We've seen the impact of that in a workplace. I know so many stories of people that have shared their story and said, I got cancer, but I don't know how to share it with my boss or my manager, or I did share it with my manager. And I said, I didn't want everyone to know, because so many people are so afraid of how others will perceive them. And then they said, oh, I didn't want my boss to know, but when I did tell her, she actually told everyone else. And, things like that. So it's about knowing what your rights in the workplaces is, that kind of education. There's this whole advocacy work that we do as well. just sharing the news. And I think one of the things also is everybody, there's an impact. So most people, I think one of the most common threads is if you've been diagnosed, it's okay, you need support. And support can be in many forms. And one of the supports is knowing that there's emotional and that there's information. Often when you go somewhere, I know I've got many family members that have been diagnosed, and I've been with people to the doctor, and it's so overwhelming. There's so much information. And often there's so many of the medical professionals don't have the time to sit with you and say, this is what you have, and there's so many questions, So it's going with them and saying, okay, this is what they're saying, and this is the next process. So I think there's a huge role to play, and just that impact of that and how it affects you mentally, never mind emotionally. It's, oh my goodness, I've got this cancer. How's it going to affect my work? How's it going to affect my day-to-day? How are my friends going to cope? So there's so many aspects to a cancer diagnosis.
Yeah, it's really a lot. It's really, really overwhelming. I think that's the word. And well, you mentioned a few things, and I'm just going to tell people to go to your website right away because we're going to try to cover some of the services that you have. But your website is CANSA, CANSA.org.za. And if you're going to get interested, if you're listening and get interested on this topic, go there and check out more. But Lucy, guide us through the services that you provide, because you're painting a picture here of 90 years of service, and you form these pillars that we just mentioned. You cover a lot of ground. So what are your services, highlights, and how are they structured somehow?
So what we do is, as the cancer organization, we decided on those 3 pillars. We've got research. So we're the only one of the few non-profit organizations in South Africa that do research. So just to clarify, it's not research into the cure for cancer. We simply do not have the funds for that. Definitely, it's all about how to lower the cancer risk. So looking at ways that you can lower the risk, looking at food, looking at products or health programs that are good for you, how to lead a balanced lifestyle. Also things like our service. Is our service making an impact? Doing constant surveys. We also host conferences, or we get our researchers to actually publish journals, and we cover the top 5 cancers in South Africa. So if you look at the top 5 cancers, you're looking at definitely colorectal amongst men and women, prostate with men, breast and cervical, particularly cervical is quite high in South Africa. And then you've also got non-Hodgkin's lymphoma, which creeped into the top 5. And then you've got lung cancer as well. So all of those cancers particularly are the areas that we cover, because that is the bulk of the population that has now been affected by those cancers. And also melanoma, skin. We're in the Southern Hemisphere, which means we are in the sun a lot. And of course, we didn't know what we did in those many years ago when so many people were exposed to the sun. And if you look at the climate, we are being exposed to stronger and heightened UV ultraviolet radiation, which is a huge risk to get skin cancer. So, that's what we cover under our research. And then we've got health campaigns, and then we've got the education part. So the education is about, how are we educating about the different types of cancer? How can we educate people to lower their risk of cancer? How can we educate so that they know, okay, I've been diagnosed, but there is help for them. So that's that part. We also do what we call advocacy, where we are advocating for patients that, we say they're sometimes without a voice. They might be going to a public hospital and they're not being treated right away. Or they receive information and they only get an appointment in 6 months' time, which is really, we know early detection is key. So, wow, hey, we need you to, so we liaise with our department, and we've got an excellent advocacy team that will phone and say, you've got to see this person straight away, and we get their file number. So that's part of the work we do. We also educate about their rights and saying, do you realize you are entitled to a screening? And we go and we lobby and we influence. So part of it is a lot about the anti-tobacco. We're very much about making sure we create this smoke-free environment for all our people, because, smoking is very much linked with CANSA, and also you get secondhand smoking. So if you're not smoking, you're still being exposed. So we're very much in those laws. And then the other part is, of course, the support part is where we now, okay, you've been diagnosed. How do we support you? We've got all these services. And I think what's important is that we cover all cancers. So many times you might find an organization only dealing with children, only dealing with breast, or only dealing with men's cancers. We cover everything. We have from young, our cancer, what we call Tough Living with Cancer, or TLC, our Tender Love and Care. So that's our children's program. And we have a special program aimed at teens, young adults. You know, often young adults are often just overlooked. Everyone gives attention to the young child or to the parents. And you've got what we call that missing middle, that teen who doesn't want to be in the same room as with the Barbies and Spider-Man. And then they don't want to be with the adults either. So we've got to communicate in a different way with them. And we cater for them specifically. We have online programs for them. And then, of course, we have incredible services. Wow, we have so many fantastic social workers, nurses. So the nurses for screening, we offer screening, what we call our cancer care centers, or our offices, our branches. And we do screening at their homes and at their offices, and we encourage people to come. So we do pap smears, we do clinical breast exams. We also do for the men a prostate-specific antigen test, or a test to detect if there's any abnormalities, so that we can help with getting men going, making sure that they're educated. So that's part of the screening. We do a whole lot of things with skin, because we're so much exposed with, skin cancer. We very much, we've got a machine called the photo finder, and we examine the skin, and we encourage people to look for spots on the body. So that's all part of what we do. And then two of the services I really want to share is we have the most incredible thing called counseling. So, of course, we had COVID in 2020, and we couldn't move around. And it was very traumatic for the people that were living with cancer and their families. And we needed to make sure that we could still support them, empower them, give them information, and help them. So we came up with cancer telecounseling, which is free telephonic counseling in 7 languages. As you know, in South Africa, we have 11 languages, including English. And you've got all these languages to consider. Of course, the most common ones would be isiZulu, and you've got English, and you've got CANSA, isiXhosa. So you look at the top 5, because as a non-profit, we also cannot engage with all the languages. So we look at where the bulk of the people, and we made sure that we could provide support and call people at the time that suits them. We make an appointment. We made sure we also use, can you believe it? Incredible, WhatsApp. We have so many WhatsApp support groups, just using the phone and just using video calling. Even some of our services, we would phone somebody in a very remote town in one of our provinces or boroughs. I don't know what you would call them. In certain places, it would be a province or a borough or a town, a region, and we're very sparse. And we would actually use the video call and say, and they would want to know how to use a stoma bag or how to use a certain medical thing, and we would be there helping them. So telecounseling is one of the most amazing services that we continue with today, and we're always looking for more services to introduce. And the other service I really want to share about is our cancer care homes. While people are getting treatment, and particularly for those that don't have medical aid, you can stay in our cancer care home. So we provide the food, nutritious meals, 3 meals a day. We transport our patients to and from the nearest treating hospital, and we provide care and support, counseling. We might be doing massaging that day. We might be having a support group that day. And that is just such an incredible service that's so unique to us. Besides our counseling is our cancer care homes, and we have 8 of them in the country. We have 9 provinces, and that one last province doesn't have a proper treatment facility, so therefore it didn't make sense to have a home there. So we have this incredible service that we provide that tries to cover as many people as possible that have been diagnosed.
Wow, I'm really amazed. This is really impressive and such heartwarming work that you do, Lucy. After doing so many interviews with cancer organizations like I call them that, sorry. What I understood is
Absolutely.
that this sense of this ability to create this community, getting people together, getting people in touch and making them feel like taken care of. It's really vital. It's what makes sense, I would say. It's more than what helps the most, or it's what makes sense. So it's really beautiful to see that those are your highlights. So I think it's very, very, very heartwarming. And I gotta ask you, because you mentioned so many things, and that gives me this sense of the structure you need to have. And this is something that I feel like we need to address, especially in cases like this, because we sometimes think of nonprofits as this bunch of people that just get together for a cause and does good and moves on, yay, just because we believe in the cause. But it takes a huge structure behind it. Could you walk us through it? How do you make this whole thing work, in a sustainable way? Because 90 years, it's not 9 minutes. It's a really long journey. So how are you able to get the whole thing going?
Very important. It is, how do we maintain sustainability? How do we make sure that when we offer that service, it continues? And I think in the nonprofit industry, you have to pay, we want to make an impact. You want to have a project or a program that's running. In order to ensure that that program is run well and that it's sustainable, it's not just a once off, it is 3 to 5 years, 5 to 10 years. We have what we call a 5-year plan, a 3-year plan, and a 10-year plan. You have to have that vision. You have to see what is going to impact your country, what is going to impact the community. And I'm so glad you used the word community. And that becomes important. So, and we often say to funders, you have to fund us because we believe in our program, but it's not just about the program costs. It's about the salaries of those people who are running those programs. You have to pay for the nurse. You have to pay for the social worker. You have to gather the information. You have to do monitoring and evaluation. How can you know what impact you're making unless you have qualified people? So we have got incredibly qualified and really passionate staff that do an incredible work. We only have about, on average, 140 staff. But what is amazing, we have an incredible amount of volunteers. We love our volunteers. We would not be where we are without volunteers. They are amazing. So, and we get so many cancer survivors that volunteer for us too. So we have many volunteers. So although we have a small group we try to keep the operational costs very small, very limited. We make sure that we are what we call a lean, mean machine. That has to be done in that way. We have a very small marketing team. We only have about 6 or 7 people that we operate as a group that have to make sure that they are doing all the marketing and communication. We make use of social media, all the free platforms. We even make use of AI, artificial intelligence, and see how can we leverage and help us so that we are spending our time being smarter and giving our resources in a different way. So we have incredible, wonderful volunteers that give their time, that give their effort. One of the examples is we have our public hospitals that are really struggling. Our health system is really not doing well. And what we do is we take our volunteers, they go and we set up an information support desk at the public hospitals, run by our volunteers at specific metropolitan region. They are there for the day. They will sit there and say, this is what we do. Come here. If you've been diagnosed, let us help you. These are the services available to you. There's our telecounseling. There's our care home. If you need screening, I mean, they obviously have been screened already, but if you need further screening, if you need to know how to help, we are here for you so that they are not alone. So we're there to be exposed. We also make use of social media, as many free platforms as possible. So we're on Instagram, we're even on TikTok. We try to get and we get our young people, our young volunteers to teach us. So, and we try to collaborate. I think it's important. You have to collaborate with other organizations, other nonprofits that have the same values as what you do. So when you collaborate and you work together, you then establish and you can actually make a bigger impact. So I think funding is it will always be a challenge. It'll be a challenge that we've been faced because the economy does so bad. When the economy does bad, non-profits tend to do badly, but we rely on them because without us, we are often doing the work and supplementing the work of what our government should be doing. And we believe in private-public partnerships, so we have incredible, wonderful sponsors and partners that do come on board. And without them, we wouldn't be able to offer these programs. So we believe in a collaboration, and we believe in being sustainable. You have to be able to be sustainable, because how can we continue offer telecounseling? How can we continue offer the screening, the care homes? We have an incredible department that just do the stoma, the equipment, the medical equipment, because so many people out there, I mean, you're talking a stoma bag is, if maybe perhaps our listeners might not know, it's a bag that gets fitted for people to collect waste because they've either been affected by colon cancer, and might not even be cancer. It could be a car accident you've had or some sort of injury. So you've got all these medical stoma and colostomy bags that they need to give access. I mean, we know survivors that have shared stories with us where they were sent home from a clinic with just a plastic bag. I mean, that is just shocking. You can't, those kind of things, that's what's happening in our rural areas. So we have to go out to the rural areas and be accessible and be able to speak their language. So one of the things, our challenge is we need more income so that we can translate our materials into other languages. That is a huge thing we always need, and just to keep on keeping us going. So I'm glad you asked, because so many people do think, oh, you can go out there and do it. You can't. You need to make sure you've got the right staff and volunteers and the expertise to make sure you're making that impact.
Thank you. Thank you for sharing that and giving us such a clear view of what goes behind, the curtains, let's say. It's something that I personally don't think I know enough to fully comprehend how you make the machine going on. Honestly, I think it's such an intricate thing. You need to be careful, and this ability to keep it lean, to keep it working on just what's necessary. It's really, really a high ability to be honest. Well, considering all of this, I also need to ask you, for the listeners that, are following us right now and want to get involved, what are the best ways to help CANSA keep going?
Well, we are on our website. We have every information you can think of, and it's www.cansa, as in cansa.org.za. And then we're all over social media. So we do have Instagram, we have Facebook, we have got X, or formerly Twitter, and we've even got Pinterest. For some reason, Pinterest, people follow us on Pinterest, and it seems to be doing well. It's just interesting to see how the social media platforms evolve. We have got WhatsApp as well, but what we do is we have WhatsApp if you want to know any support, and we have what we call a cancer help desk. So the cancer help desk is there to help, particularly in South Africa. Any information you might want to know. I've just been diagnosed, where do I go? Or I want information, or I want to get involved. We have a lot of, we run our own national fundraising project, so people may want to get involved there. And we do have an email, info@cansa.org.za. So if people from all overseas can also email us there if they want information. We're on TikTok. We started TikTok, I think, about 2 years or a year ago. And we're trying to grow that platform because we see it's very much a younger audience. We know, in South Africa, by the year 2030, cancer incidence cases are going to double, which means we have a huge responsibility to be able to make sure we're there for them when they are, or to help prevent those cases by educating so that we can encourage screening. We did see, with COVID, a lot of people delayed going to get screening. They were afraid, they didn't want to move around. There was also limited options available because all of the health systems were really impacted and overloaded. So we saw many people didn't go, and it's catching up. So early detection is key. So we'd love people to get involved, by donate, or give your time. Perhaps you could look at a document for us and give us ideas. We're always looking for new ideas of raising funds or new collaborations. We've got we welcome global collaborations. You might have information you could share and resources that could be useful to our communities here. So you could volunteer that way. Or just follow us on our platforms. Follow us on TikTok and help us so that we can go live. I'm always interested in doing webinars and doing live shows and this kind of thing, getting to know people. Especially with young people, we need to educate them, because although we know most older people tend to be affected by cancer, a lot of younger people need to know how to lead a balanced lifestyle so that they are lowering their risk. And if they do, that they're not alone. I think that's very important. And we appreciate this opportunity. Thank you for hearing about our brand and about our cause. We so appreciate it.
Well, I'm super happy to have you here. I loved this conversation. Thank you. Thank you so much. And we're going to make sure to have all those links, social media platforms available for those people that are listening or watching us right now. Lucy, thank you. Thank you again.
Thank you for the opportunity. It was great.
And for everybody listening, also, thank you so much for staying with us for one more episode. And remember, if you liked it, press subscribe on YouTube or on your podcast app, because that shows the algorithms that this is an important conversation, and we can spread the word about the importance of the Cancer Association of South Africa, or CANSA. Bye, guys, and let's see you in the next episode.
Bye.